Good afternoon, everybody, and thank you for joining today's presentation, Allocations Best Practices or Cost Allocation Models. My name is Boris Vilgorin, and I'm with MICTAC and McSilver Institute. And I'm happy to announce that today's presentation will be provided by David, who is our partner and a colleague, and we're really excited and look forward to his presentation. But before we start, and before he introduces himself, just a couple of basic housekeeping rules. The slides on this presentation will be posted at the MICTAC website, as always. Also, any references to timelines or anything else are always as current as of the date of the presentation. And as always, please chat in your questions throughout the presentation. We did put aside some time for a Q&A portion. Might be able to even answer some of the questions during the presentation as well. So please use the chat option during the presentation, as we'll be answering questions throughout and at the end. Also, a couple of other important notes about today's presentation to highlight. One, throughout the presentation, you might be hearing references to a CFR. And again, David will talk a little bit about it. Some of you might not be as familiar with that reporting structure, but don't worry, we are in the process of working with our state partners in trying to develop information and assistance and training around CFR. I suspect a lot of you are very familiar with CFR, but again, for those who are not, there is going to be more information forthcoming around there. So just wanted to mention that because David will touch base on some of the CFR resources and references to that. Also wanted to another note, as we have made it as part of our announcement about this presentation, today's presentation really focuses more on kind of the financial fiscal side, payroll side, on tracking allocations, best practices from that component. We will not be touching too much on the programmatic piece of it with examples and other elements. We are working on part 2 of this presentation, where we're going to be covering those components there. So we wanted to, this is kind of part 1 of it. And again, as part of our announcement, that was included in the description. So without further ado, let me turn this over to David, who will introduce himself and take us through the presentation. Thank you, David.
Thank you, Boris, and welcome everybody. I'm very pleased that you'll be joining us for a little while this afternoon to talk about financial allocations of costs. Before we get started, let me talk a little bit about myself. As Boris said, my name is David Worsnick. I'm a senior consultant for CCSI. CCSI is a management service and consulting organization in Rochester, New York. We work mostly upstate with providers around a number of different issues and questions: strategic planning, financial assessment, quality improvement, data and data analytics, revenue cycle management. We are a proud partner along with McSilver as providing trainings and contact for these MICTAC presentations. So I personally have been in the business for about 42 years now. For 32 years of that, I was a chief financial officer for an organization in Western New York called Spectrum Health and Human Services. It was a organization that provided mental health, substance use services to adults and children. We also had health homes, ACT teams, supportive housing, with a wide variety of programs. And being the chief financial officer for 32 years, one of the critical elements of my job was the proper allocation of costs. And that is what we're going to be talking about today. So let's get started here. So a lot of times what we're faced with is starting new programs. So we'll certainly take an example of the new children's support services, and we're going to be building programs from scratch. And when we do that, there are a couple challenges that we need to address. The first certainly is understanding regulatory requirements. If you've recently read the SPA manual, you go through and you know what your credentials of your staff need to be, of your supervisors, what programs you're going to be providing, what are the operational definitions of the services. So we really need, at a very detailed level, to understand the guidance from the state. So that's sort of a starting point in starting new services. And when we start a new service, we have to sort of build a financial model. We have to understand what our volume's going to be, or at least project our volume. We're going to have to capture some of our costs, marry those with our volume projections, and then project out our revenues, because certainly what we need to be doing is we need to be providing new services in a fiscally responsible fashion. But one of the financial core competencies in managing financial management of any programs is to understand your true unit cost of service at the program level. So you may have 3 or 4 different services, and it is really incumbent upon you to understand true cost. And when I talk about true cost, sometimes you think about true costs make up the costs are made up of a number of different components. You have costs that you may be able to identify that are program specific. That is, one staff works in this program, and you're able to capture that cost and assign it to the program. But there are also many opportunities where we share costs across different programs. And I'll show you some examples of how we may share staffing costs, or how we may share operating costs. And it then becomes extremely important for us to be able to take those costs and assign them properly in order to understand what our true costs are. If we have costs loaded into a program, but they're not using all of those resources, then we're going to overstate the cost of that program. And we may then, at some point, do a financial analysis of our different programs. Say the organization is struggling a little bit, and we would take a look at this program, and we'd say, man, the costs in this program are too high based upon the volume. But in fact, if you had loaded some cost into that program category that they weren't actually using, you're overstating the costs, and you could begin to make some erroneous decisions about what you need to do with that program, because you really don't understand the cost basis, because you may have loaded too many costs into that. Vice versa, you could have a program that you didn't assign all of the costs to it that they're actually utilizing. You may not have given them the proper rent costs. You may not have, they may share staffing, and you may not have captured those staffing costs correctly. So then you start looking at a program and you think it's doing really great. You may make some decisions about that program that will also be incorrect because you have not really captured your proper costs. So anytime we need to evaluate programs, evaluate the financial operations of the organizations, you have to know what you're looking at. You have to be able to as best you can, assure that the costs that you're posting to any one program are accurate. So what does it take to be able to do that? Well, the first thing we have to do is we have to have a well-designed chart of account and cost center structure. I've worked with organizations who have two different program categories, two different regulatory requirements, two different ways of counting units of service, and they mush them together into one cost category on their general ledger. So as they're accounting for these costs, they put them together. But the organization then cannot tell what the true cost and revenues are for these individual programs because they don't break them out correctly. So on your general ledger, in your chart of accounts, you really need to be able to understand and capture costs at a specific program level, and you need to do that on your chart of accounts. The other piece you need to understand is to be able to integrate your service volume with your cost data at the program level. So once we've separated on the books in your general ledger your actual cost, then the other thing that we have to bring forward is the volume or the number of services that are attached to each of those programs. You need to capture those accurately also because you're going to take those volume, those units, and divide them into your cost to get your cost per unit of service. You'll do the same with your revenues and do your revenues per unit. And that's going to be a key analysis you're going to need to do at each program. So you need to understand service level. And you need to be accurate capture costs related, directly related to program services. As I mentioned before, a program may have certain kind of program supply, so you're going to direct charge those, or have very specific staffing patterns. You're going to direct charge those. They may have their own space. You're going to direct charge that. But in many cases, you're going to have shared costs, shared rent, shared utilities, shared staffing, and the critical element that we're going to talk about today is what is the best practice is related to an accurate allocation and assignment of shared costs. So what is cost allocation? So cost allocation is the process of assigning shared costs to multiple cost centers based upon a methodology that as closely as possible approximates the amount of shared resources that each cost center will consume. So the key operational phrases here are shared costs. That is a cost of a resource that is shared by more than one program. A methodology that as closely approximates the amount of shared resources that each cost center consumes. So it's a methodology. It's a method, a plan. It is a documented method by which you take each of these shared costs and allocate them or assign them on your general ledger to each of the cost centers that share those costs. So they're shared costs with a methodology to allocate them and then assign those costs in your general ledger. So let's talk about a real quick and easy example, and this is probably an example that a lot of organizations face, is that you have a single location. And in this case, we have a total of 10,000 square feet and an annual rent of $22,000. But three programs share that space. So what you need to do is you need to have a plan by which you can determine the square foot each program uses, calculate the percentage of that, and then multiply that percentage by your annual rent. So in this example, I have 10,000 square feet. Program A uses 3,000. Program B uses 2. Program C uses 5,000. You simply calculate the percentage of the total space, and you multiply that by the rent, and that's your cost allocation that you assign to these three programs. It's a simple allocation methodology. It's an accurate methodology. Now, some programs have shared space, so these three programs could be sharing a waiting room, as an example. So what you do is you'll see in this definition is that you actually, let me flip to the next. So in the rent example, you're going to determine the exclusive square footage assigned to each program. You may have shared space, but what we're going to do is we're going to go in and count the exclusive square footage that each program uses. We're going to calculate the percentage used by each program. We'll allocate the shared cost based upon the percentage, and then we'll use this method for all costs related to the space, such as utilities and maintenance. So again, this is a simple example that many organizations use already with the single location sharing programs across that house multiple programs. So you just go in, find the exclusive square footage, calculate the percentage, multiply it by the rent on a monthly basis, and assign that cost on your cost center to that program. Do the same for utilities and maintenance. That's pretty simple and straightforward. So as Boris mentioned, we're going to make reference to the CFR in this presentation. CFR is a consolidated fiscal report. MCTAC and the state will be providing or are currently working on additional training for those individual agencies that are not familiar with this reporting. It's primarily a fiscal report, your report at the program level. And the CFR has a manual with a number of appendices. There is Appendix J in the manual that provides guidance on what kind of methodology that you will use to allocate space, to allocate your costs. So it would be useful to go through this really quickly. So OTPS is your operating costs, such as food. A simple way of doing that would be meals served. You'll see we already talked about repair and maintenance and utilities. You're going to use your square foot methodology for allocating that. You may have transportation-related costs that are shared across programs. Well, you're going to use number of trips or mileage. Staff travel, you may use full-time equivalent, expensed equipment, raw materials, participant wages, if you have them, maybe units of service. Staff development, full-time equivalent, supplies and materials, units of service, and telephone may be the number of lines. Or in other cases, units of service. But I think the caveat at the bottom of this, and this is language right from the CFR, is if the recommended allocation method is not reasonable, the agency provider may determine a more reasonable method of allocation. So as an example, you have in here 3 different or 4 different expense categories that the state is recommending that you use units of service as the method of allocating your costs. Well, you may have 2 programs that count units differently. You may have a program that a unit is a monthly contact, and another program that may have a unit at every time that you've provided an intervention. Units can have different weightings to them. So in the cases where you're looking at these allocation methods and they're just not making sense for you, then you need to think about coming up with a reasonable method for your allocation. One of the recommendations that I have is that you document that method. Worst case scenario, what you don't want to face is having an audit of some form, and the auditor coming in and asking you how you allocated this particular cost, and you can't remember. Or you can't remember, maybe you remember how you're allocating it, but you don't remember what the justification was, why you could not use the methodology that was recommended. So again, you're going to find as you go through your different expenses at the program level that some of the guidance that's provided out there just is not going to work well for you. New York State recognizes that. They allow you to use something that's more reasonable. You will need to be able to document the reason why the guidance that you were given doesn't work for your program category, what methodology you used, and why you think it is a more reasonable way of allocating cost. So you're not locked into this, but I think it is important to start from the guidance that's provided from the state to see that it works for you. So let's go on to, those are your operating expenses. In many cases, you're able to direct charge or identify costs that are program specific. You may have specific types of supplies that one program will use and the other will not, and you can assign those. You may have special kind of equipment purchases. You may have one program that does work in the community, so you have mobile technology. You can identify those costs and assign them to that program because the other programs are office space and they don't have that equipment. So your first step is to take a look at all your costs and see which are really very specific to the individual program you capture those costs. The costs that are shared that you cannot identify in any easy way which program uses those costs, then you can allocate it. You don't want to get too crazy about your direct costs. You don't have to have, if you buy 50 pens that are shared between two programs, you don't have to have your staff sign out a pen so you can assign the cost properly. That's not a significant cost, and it's not material, so you could take that supply cost and allocate it in a methodology that makes sense. In that example, what might make most sense is FTEs. But so you'll have to think through some of these allocations. So again, start with the guidance from the state. If that guidance works for you, then use that methodology. If it doesn't work for you, it doesn't accurately identify the costs that are going to be consumed by the individual programs, then sit down, think through what method would work best for you based upon the information that you have available to you. You document why you're using that methodology and then use it on a going forward basis. So let's talk about another piece that I'm seeing more and more is a shared staff example. So what we have here is we have myself as the staff. I'm paid 1,950 hours in the course of the year. My salary is $48,000, which gives me annual of $24,000 and a biweekly of $18,000. But I work in 3 separate programs. So in those 3 separate programs, what I am assigned is I have 30.75 hours in one, 28.5 in another, and 15.75. I'm going to calculate what that percentage is, and then I'm going to use that percentage times my biweekly rate or my monthly rate, however you want to do it, and that's the cost that gets assigned to each of these individual programs for my salary. Now, in some cases, what we have is staff are shared on a fixed schedule. That is, I may work 3 days a week in one program and 2 days a week in another program. And we have situations many times where that is a fixed schedule and it does not vary. There are, though, in many cases where that time is variable and I sort of flex back and forth to the programs as needed, and then we will need a different method for capturing those costs, which we'll talk a little bit more about. But in the shared services, if you can have a fixed schedule, then you can calculate a fixed percentage and multiply that by the program basis. So you did, like I said, you determine the number of hours worked in each program. You calculate the percentage, you allocate the cost based upon that percentage, and then you post those costs to each of the individual programs on your general ledger. Then you use the same method for costs related to fringe benefits, travel, and staff development. You saw staff development was, in the OTPS example, was based upon FTEs. Well, when you allocate me, my full-time equivalent, across the 3 different programs based upon the time that I'm working, you are allocating staff development costs by FTE. You're also allocating my travel costs by FTE and my fringe benefit costs by FTE. So this is the methodology that we're going to apply and will use consistently for my cost under the circumstances that I have a fixed schedule. So what does the guidance say? So the guidance on schedule on Appendix J says that the best way of allocating costs is actual hours of service. That's the preferred statistical basis upon which to allocate salary and fringe benefit for staff who work jointly between programs. And if the preferred method cannot be utilized, allocation based upon time studies will be acceptable. Well, let's talk about those 2 things separately. So, actual hours work. So, if it is in fact that I have a fixed schedule and I have a way of recording my time, a timesheet or some other method, I'm going to record 3 days in one program. I'm going to record 2 days in another program. And those costs, that percentage is going to be applied. And I will have some documentation, either through my schedule or the recording of my time, to support that allocation. So now let's think about a situation where I may not have as much of a fixed schedule. I may flex my schedule back and forth based upon demand of the program that I'm working at, or at the request of my supervisor, or maybe other factor that forces me to flex back and forth. Well, the preferred method then would be is that either on my timesheet or some other external document, if my payroll system doesn't allow me to do this, is on a daily basis, I would record the hours that I spent in each of the programs. Sometimes that's easy to do, and sometimes that's very difficult to do. It's easy to do if I work in larger blocks, or like in the other example, I'll work a day in this program and maybe a half a day in the other program. But if I'm shared between 2 programs, in 5 minutes for 5 minutes I'm working in one program, and then I'm going to switch base, and for 15 minutes I'm going to be dealing with a client that is working in that is assigned to a different program, and then 10 minutes later I'm going to do something different, and I go to a staff meeting that we're talking about clients in both of these programs. You could see how that could become a very difficult and administrative burden of trying to track very small, discrete times across different programs. So like I said, that recording the time on a timesheet or an external recording method is, in fact, the best way to capture your shared staffing costs, but it is not always Another methodology that the CFR talks about is time studies. So what they would recommend is that you take a 2-week period, and for those 2 weeks, you ask your staff to undertake the burdensome task of recording the amount of time that they spend in each of these programs, and build a log that can then be used to allocate costs. So the state recognizes that it is burdensome to be able to capture very small, discrete time frames across different programs, and to have staff do that day in and day out would be quite an administrative burden. So they give you an opportunity to say, okay, we'll take away that administrative burden to do that all the time, but you can do that on a time study basis, say 2 weeks every quarter. And then the person logs their time in a discrete amount of time as possible. You aggregate that then for that time frame. You have it's a proxy for what is the normal, what might be a normal way that they spend the time. This works is if, in fact, a time study period is, in fact, representative of the way that that individual will spend their time through the rest of the quarter or through the rest of the year. So that may not work when you assign a person to a startup program where they're spending a lot more time, but once that program is started up and is running smoothly, they won't be spending that much time. So one of the ways that you can address that is having periodic time studies done. And so you may have a time study that represents a startup period for the first 6 months, and you're going to allocate costs that way. Or then you may, once that program is running well, you may want to step away from that allocation method and use a different methodology or a different time study methodology that is more representative. Because what we're really doing is we're working towards accuracy. So it's preferred to have them record their, as I said, actual time by program in a timesheet. A lot of payroll systems will allow you to enter the hours of the staff at the program level, and then your payroll system will create that allocation based upon the time's work. So all you have to do is take the recording of the time. If you're using electronic timesheet, and an individual can select a program, different programs for the time that they're spending, then they can go right into their electronic timesheet on a daily basis, enter the time that they spend in each of the programs that day, and that will roll up, and your payroll systems will be able to handle that. Sometimes payroll systems can handle that depending on the system that you're using, but in all cases, you will want some kind of methodology for documenting how you arrived at your allocation. So I've seen some agencies actually use paper timesheets to capture the time worked in different programs. That's a bit of an administrative burden also, because somebody's got to go in and add all of those things up, and I don't know how most folks have a relatively short timeline between the time that staff finish their timesheets till they have to enter their payroll. So having paper kind of timesheets to aggregate that time could really be a constraint. So what I've also seen people do is use Excel spreadsheets. So an Excel spreadsheet will automatically aggregate those times by program, so somebody doesn't have to sit there with paper and add them up. But you will need to document as best you can, either through staff recording their time at the program level or by some kind of time study to support the way that you're allocating your costs. So this is really the important piece here, because your salary costs, and you talked about, so we have salary, we have fringe benefits, we have that individual's training, we have their travel. When you think about that, that's probably approaching 75% of all of your costs within your program is going to be related to those kind of costs. And so accurately capturing those is extremely important. And it might be an administrative burden in some cases, but it is the only way that you will truly understand what each of your programs are costing and what each of your costs per unit of service might be. And I said, although time studies are allowable method, they're sometimes difficult to manage. They're less of an administrative burden, but they certainly are an administrative burden in some cases, and in some cases that they're inaccurate. So you have to sort of pick your slots. So just remember, your primary goal is accuracy. We're not necessarily doing this for New York State. We're doing this for ourselves. We're doing this for the financial stability of the organization. So when you're making decisions about your programs, when you're deciding to enhance in a program or even discontinue a program, you have to make good decisions. Those decisions have to be based upon accurate costs. 70% of your costs are embedded in your staffing and your fringe benefits. And so this is where you really need to spend the time and energy to make sure that you're properly grabbing those costs, properly assigning them. Let's talk about some special considerations, that at least some of the challenges that I've seen related to exempt or salaried staff. So some organizations don't have exempt staff record hours worked, and therefore may not have a mechanism on timesheets to record hours by program. Well, this would be a case that we may stand up an Excel spreadsheet that will have the different programs. You may see this for supervisors as an example. Somebody may supervise staff from different programs, spend different amount of time because of the credentials of the staff they may be supervising a peer program that in a new peer they may need a bit more guidance than a program of a seasoned licensed mental health professional. So, we have those kind of allocations need to be captured, but they may not capture hours on the timesheet. So you may have to have some secondary system to do it. To be compliant with CFR and to have a good cost accounting practice, you have to develop workflows that capture the amount of time shared staff spend the program on a daily basis. And these hours need to be aggregated each pay to be used to allocate the costs in the payroll system. Some people do it in journal entries. Some folks, they put their time they sort of load the time into a single program. They have their documentation, and then on a monthly basis, instead of running those hours through the payroll system, they use the data that they get from the staff to create an adjusting journal entry, and then they journalize the change on an aggregate level on their general ledger at the program level. I think that is a reasonable way of doing it. I always preferred to have staff record their time. I think that's probably more accurate. In the long run, it runs right through your payroll system. It helps you if you need to pull FTE data out of your payroll system. When you're allocating outside of your payroll, then you really don't have an accurate FTE count or full-time equivalent count of hours in your payroll system because you're allocating off your payroll system. I always wanted to know how many FTEs or how many full-time equivalents I was paying in each of my programs. I got that data off of my payroll system. And the only way I could do that is if I ran actual hours through the payroll system. So there are better ways than allocating with an adjusting journal entry. The data is more precise, and it's probably more available to you in payroll. So the other, all right. So let's talk a little bit about paying staff additional hours. So a lot of what we're seeing now is when we're standing up new programs. So I've got a new program category. I'm projecting what my volume is going to be, but I don't absolutely know what it's going to be. So what I may do is I may pay staff additional hours to help me implement a new program. That has certain advantages. So if I'm paying 37.5 hours, I may go to a member of the staff and I say, we're standing up this new program. We don't know really how many of the clients are going to be, but what we'd like you to do is throw 5 hours, additional hours a week at this program. We'll pay you for those 5 additional hours. And the advantage is that programs can be rapidly implemented that way. Your initial recruiting and onboarding costs are reduced. Demand can be evaluated, and you can then start hiring full-time staff as you begin to understand what your volume requirements are going to be. And a lot of staff are actually interested in additional pay for additional hours. So one of the ways that we can go about doing this then is paying staff additional hours. So here would be an example of additional hours in program B. So I have a staff who works 35 hours or 75 hours a pay in program A. I ask them to spend an additional 3.5 hours a pay in program B. So what I'm going to do is they are one full-time equivalent in program A. There's 0.047% of a full-time equivalent in program B. So now I have really more than an FTE, although it's a single person. I have hours in excess of an FTE. I'm going to take the percentage of time. Again, 1 hour of 1.047 is 96%. And 3.5 hours of my 78 is 4%. And so I'm going to allocate. I'm still going to have under 100%, but I'm going to allocate that based upon the hours that this individual spent. So we're allocating based upon what program they worked in. They had additional hours. We're going to pay that individual those additional hours and assign them correctly to the programs. So there are some additional hour considerations that I like to talk with people about. When you're paying hourly staff, you have to be careful that you're paying time and a half for time over 80 hours on the biweekly pay. So sometimes, if you really think about it, although you may need to pay staff time and a half, it might be more efficient for you than going out and hiring a full-time equivalent when you don't have enough demand. So you're paying somebody a full salary, but you're not getting billable services from them. Employers can track the hours. And the other consideration, employers sometimes don't like tracking hours of exempt or hourly staff. They think it actually jeopardizes their identification of that staff as an exempt staff. You can track extra hours paid to exempt staff, and you can pay them on any basis. Most employers convert their annual salary into an hourly basis and pay additional hours based at that rate. That does not compromise their exempt or salaried status, and you do not need to pay them time and a half over 80 hours. So you still need to document the number of additional hours in which program those additional hours in. You have to have a methodology for paying those staff, and you need not be concerned with your salaried staff with either the 80-hour limit or the fact that you're counting time. Your hourly staff obviously will need to be considered that 80-hour rule. So that's sort of this is designed to be a very brief overview of the different components of the allocation best practices, what the state guidance is, what are some of the concerns that you should have. But I think that, again, for me as a chief financial officer, I have to know my actual cost per program. The only way I can do that is to assure that I have a set of allocation methodologies that identifies, first of all, the shared cost. Secondly, have a method that allocates costs in a reasonable format based upon the resources that are going to be consumed of those programs. I have to take those costs and assign them accurately at the cost center level. Then when I begin looking at my cost per unit, my revenue per unit, when I begin making decisions about programs and their financial viability, I'm working against an accurate set of data. So that takes us to about 10 minutes for questions that folks may want to chat in. I haven't seen any come across yet.
Yep.
And while we're waiting, Boris, do you have any comments or observations you'd like to make?
Yeah, no, but first, thank you. I just want to say thank you, David, for this presentation. And like you said, this is an overview, and a lot of these components could have a lengthy presentation on its own. So clearly, there is still a lot to cover. We did get one question so far. And it was related more about administrative staff and allocations. And I suspect there's nothing special or different about administrative versus clinicians, practitioners, or individuals who provide services in general. I think it's more about, like you said, salaried versus non-salaried, and the practice you have versus what their role in an organization is. So that was the question about administrative staff. So anything to add to that?
No, I think that one thing that happens is it becomes a little bit more difficult sometimes with administrative staff, particularly if they move from program to program to program, and there's these little short time slices that they're spending on a program, and then they bop to something else. That becomes sometimes an issue in doing that, but it is still figuring out a method that best is able to capture in a reasonable effort of how much how much of the time of that administrator each program uses. It's a little easier with supervisory staff, because those time slices tend to be a bit more dedicated.
Excellent. Yeah, and also like David said, I will encourage folks to chat the question in. We got another question in here. What about the business office, like accounting, as an example of one of the administrative staff, duties? So like an accounting person.
Yeah, that becomes really difficult. So I think that if you have an accounting person that you're allocating across programs, then the question is, what is reasonable? Is the dollar value or the dollar amount of the program, or basically the size of that program, a reasonable way of allocating a finance person? Or are the number of FTEs in that program, I've seen payroll folks allocated by FTEs, An FTE is a reasonable proxy for the amount of work that an administrator spends in a program. So if you have a program that has 50 staff versus a program that has 5 staff, you're going to be spending much more time, most likely, in that 50 staff program. It might be more complicated. It may spend more time. So you have to really drill down to what is the most reasonable method that you can justify and document to share those costs. I think what many organizations do is they put those kind of costs that are so difficult to capture, and they put those costs into administration and overhead. But we do realize that with a cap on the amount of administration and overhead that you can have, that sometimes becomes very difficult to put all those folks in administration and overhead, and then you have to direct charge. So total cost would be reasonable. FTEs would probably be reasonable. You'd have to take a look at the particulars of each program and make that decision.
Excellent.
One thing that
go ahead. Sorry.
One thing that I had not mentioned, and I was remiss in that, is that you need to review your allocation methodologies at some level, at some point in time. I've seen organizations who create their create their methodology, their allocation methodology. When they're doing their budget, they apply that methodology for the entire year, and then they evaluate it again. I've seen some organizations evaluate their allocation methodologies on a quarterly basis. And I've seen some allocate and change their allocation, review their allocation data on a monthly basis. I don't think there's any real answer to how you're doing it. If your programs are absolutely stable, there's not much changes, and you're capturing costs by staff on a regular basis, on a payroll basis, then a yearly allocation might be fine. But if your programs vary, and if you're using an FTE calculation and you hire 3 new staff for a program, then a yearly allocation is not nearly enough. You may want to go to a quarterly basis. And if you're building out a new program and hiring a lot of people, you may want to review your allocations on a monthly basis. So I always did a monthly review of my allocations, but I think that's only because there was a lot of moving parts in the programs, and we had a number of cost centers. But I think a quarterly review would probably be sufficient.
That's great. Yep, thank you. We have one more question, I think. Is there a minimum weekly amount of salaried employee has to get paid in terms of complying with minimum wage? So, for example, if someone works 40 hours and is paid only $1,000 or $100 a week, $100 a week divided by hourly, technically it would be below minimum wage. Is that an issue?
There is a dollar value threshold for payment related to determining whether an employee is salaried or hourly. And I do not remember that off the top of my head, nor would I want to give guidance and give somebody the wrong answer. So there are really clear rules that are related to the process that you would go through to determine whether an employee is an exempt or salaried employee or an hourly employee. And worst case, you could also consult legal counsel on that. But I think those rules are pretty clear, and I don't remember them off the top of my head.
Yeah,
and they did change.
And I would agree that I think consulting with legal counsel both on determining salaried versus non, and also what would be the appropriate dollar thresholds would be the most prudent way to approach this. So seeing that there's 2 minutes left and we have no other questions that came in, again, I just wanted to thank everybody for joining us today. Hopefully, it was helpful. And at the same time, thanking David for this presentation. As always, we have recorded this presentation and it will be available on our website at mctech.org. And if you do have other questions after you hang up, please don't hesitate to send our way at mctech.info. And so thank you, everybody, and have a great rest of the day. And thank you, David, again.
All right. Thank you,
Take care, everybody. Yep. Bye-bye.